Hello, in this video I'm going to talk about the boundaries of the axilla. So axilla is a pyramidal shaped space. It actually is present between the upper part of the thorax and medial part of the arm. So this is arm here, medial part of the arm and the thorax, and between then axilla is a pyramidal shaped space. Here you can see from the inferior aspect this is actually axilla. So I will discuss the different boundaries of axilla one by one in detail. So this is a pyramidal shaped space. Its apex is directed upward towards the root of the neck, and its base is directed inferiorly and laterally, and it's covered by the skin and the superficial fascia, axillary fascia. So first of all, it has got anterior boundary here. This is the pectoralis major muscle, and pectoralis major muscle, it actually forms the anterior boundary of the axilla. Anterior boundary of the axilla. If I remove pectoralis major, then pectoralis minor muscle. So pectoralis minor and pectoralis major muscle, major and minor muscle, these two muscle along with their fascias, for example, for minor deep clavipectoral fascia and for pectoralis major pectoral fascia, they actually form the anterior wall of the axilla. So pectoralis major along with this pectoral fascia and pectoralis minor along with clavipectoral fascia forms the anterior wall of the axilla. So now it's medial wall of the axilla. You can see it is formed by the first rib, second rib, third rib, fourth rib, along with their intercostal muscles, and overlying serratus anterior muscle. So again, first rib, second rib, third rib, fourth rib with their intercostal muscles and overlying serratus anterior muscle, they actually form the medial wall of the axilla. And the posterior wall of the axilla, here comes the posterior wall of the axilla, is formed by the scapula and subscapularis. This subscapularis and along with the scapula, it is being formed by the in its upper part, and inferiorly it is formed by the posterior wall is formed by the latissimus dorsi muscle and teres major muscle. They form the posterior wall in its inferior part, and superiorly it is being formed by the subscapularis and the scapula. And then comes the lateral wall. Lateral wall is actually a narrow, it is being formed by the when your anterior and posterior wall, they converge towards each other and they result in the formation of a narrow strip like lateral wall. So again, here comes the cervico-axillary canal. This is cervico-axillary canal. Cervico-axillary canal, it is being formed by the first rib here, medially first rib, anteriorly clavicle, and posteriorly superior border of the scapula. They form the cervico-axillary canal. So the contents of axilla are axillary sheath along with axillary artery, axillary brachial plexus, then axillary vein, then surrounding fat along with lymph nodes. They actually form the contents of the axilla. And base of the axilla, it is being formed by the skin, superficial fascia, deep fascia. So this was axilla and its boundaries. Thank you very much.